So today we will start with another important topic, that is clinical approach to childhood vomiting. So how we can have an approach to vomiting in children. And vomiting is one of the most common presentation or symptom in case of children. Okay, but actually what happens is when the parents come and they say that my child is vomiting, we need to clarify some of the important terms. What I mean to say is, whenever a patient is complaining that my child is vomiting, the first thing that what we have to do, that we have to confirm that whether this is vomiting or something else. See, most of the time, so many presentations which mimics the vomiting, but actually it is not vomiting. And anything which is coming out from the mouth, it may be food content, or it may be some secretions, or it may be some saliva also sometime, is considered as vomiting according to mother, especially in the newborn. So before jumping into conclusion, we need to clarify that whether this is really a vomiting or something else. Now, what exactly vomiting means? The definition of the vomiting is there will be forceful expulsion of the gastric substances because of abdominal and diaphragmatic contraction, and the vomitus comes in large quantity and falls forward. Okay, chadayet vegayet vegayan angabanjane. So what Ayurveda says. So it comes forcefully. Chadayat anam vegayat angabanjanir. So it comes very forcefully and falls forward. Okay, so that is vomiting. That is vomiting. And another important term which will going to confuse with this vomiting. So in case of vomiting, there will be forceful expulsion of the gastric content, and the contents will fall forward, and there is a force, projection of force will be there. And why this is happening? Because there is a forceful contraction of the abdomen and as well as diaphragmatic muscles, and because of which these products of vomitus is falling forward forcefully, and that is called as actually vomiting. That is called as vomiting. But another term which is there is nausea. Nausea is it's not only the vomitus which will come out, but also there will be some unpleasant feeling and some of the autonomic nervous system changes accompanied with the vomiting. So patient complains of excessive salivation or difficulty in breathing just prior to nausea. That means usually vomiting is associated with the nausea. So first there will be nausea will be followed by vomiting most of the time. And the question comes, why this nausea occurs? This is actually a prior stage to vomiting, and this nausea is because of involvement of autonomic nerve system changes. Because of, we know that the parasympathetic, sympathetic nerve systems, so they are supplying to the smooth muscles, and nausea is an unpleasant feeling along with the excessive glandular secretion, especially in the mouth if you say the excessive salivation, or there may be sometimes difficulty in breathing just prior to nausea. Okay, so this is associated with the vomiting most of the time. And sometimes even the parents may be confused this nausea with vomiting, because nausea is also a stage where there is an unpleasant feeling will be there, and along with that there will be excess salivation will be there, or excess glandular secretion will be there. In the mouth, when we say it is a parotid gland or submandibular glands, so the salivary gland, more secretion will be there. Sometimes this may be also confused with the vomiting by the parents. But the most important thing which has to be understood, especially in the neonate, is about the regurgitation. So what is the difference between the vomiting and regurgitation? Regurgitation is effortless vomiting of gastric contents without any force. So there is no force. That means regurgitation is not involved in the contraction of the abdominal muscles or diaphragm. Okay, there is no forceful contraction of the abdominal muscles or diaphragmatic muscles. It is an effortless vomiting. That means just contents are dribbled down back or expelled out. Okay, it's not forcefully done. just from the side of the angle of the mouth, the contents are fallen down. It's totally effortless. Of course, gastric content may come outside. Gastric content, omitus may contain the gastric contents, but it is effortless and there is no forceful contraction of the abdominal muscles. And most of the time, the quantity of the omitus which is coming, and that is also small quantity. In actual vomiting, always the content will be more. Whereas in case regurgitation, content is less, and it is not at all forceful, it is just dribbling. Okay, it is just dribbling. So this is called as regurgitation. Most of the time neonates and newborns, so they will have this regurgitation, and often this has been confused as vomiting by the mother. Immediately after the birth, usually when you go for the breastfeeding, and after breastfeeding such type of regurgitation is common if the burping is not done properly. Or if it is overfed, then also there is chance of this regurgitation. The reason is very simple. The cardiac sphincter is not much mature, and there is every chance of sudden opening of this cardiac sphincter. So there may be small quantity of the feed which is coming out in the form of a regurgitation. So this is the main thing that we have to do whenever the mother comes and says that my child is vomiting. Differentiate it whether it is vomiting or whether it is regurgitation. Another term which is used in the same context is retching. What do you mean by retching? Retching means it's the rhythmic contraction of the abdominal and chest muscles before vomiting. If you look into the Vamana procedure explained in Ayurveda, before the Vamana, so what are the 4 or 5 steps that happen? So Charaka beautifully explains. Lalata Sveda will be there, and then pain will be there, so discomfort will be there. So like that 5 stages of Vamana before the actual Vamana content comes out. So he explained, Charaka explains. So that also matches with the same. Retching means it is nothing but rhythmic contraction of the abdominal and the chest muscles just before vomiting. In the meantime, there is one more word which is called as cetophobia. What do you mean by cetophobia? Cetophobia is a word which means aversion towards the food. When the child is having aversion towards the food. So same has been explained as bhaktha dvesha in Ayurveda. Prakshiptantu mukhecha annam annam na ruchim utpadayanti. So that is bhaktha dvesha. Okay, so cetophobia is nothing but aversion towards the food. Another term which is commonly used is rumination. Rumination is usually seen in bovine animals and some other animals. You know that what cow actually doing, whenever cow is taking some of the food, first just is engulf and it will be stored in one part of the stomach. And whenever the cow is free at the time of sleeping, etc., at night hours, so it bring back this particular engulfed food material back into the mouth and start churning. You might have been observed that. So this is called as rumination. Okay, so many of the animals follow this method. So there will be a storage bag like structure will be there in the stomach. Whatever food it consumes, it gets stored there, and when it is free later, so this food will be brought back into the mouth and churned again. It is engulfed. Okay, so sometimes children do have this habit of forcefully bringing back the stomach contents back into the mouth and then churning or then spitting, whatever. So usually in mental retarded children we find this situation, or some of the stress related disorders also it is seen, or habit disorders also it is seen. So okay, this is called as rumination. So rumination means repeated regurgitation which are re-chewed and swallowed. That means forcefully the abdominal contents are brought back into the mouth, again it is chewed and then again consumed. Okay, so this type of disorders are called as rumination. So when we look into this particular vomiting, so these are some of the important words that we have to understand, like vomiting, nausea, regurgitation, retching, cetophobia, and as well as rumination. Now we come to the next part. When do the case of vomiting, when it is significant? That means at what particular time or at what particular age this vomiting has to be considered as significant. Now this is also confusion. Most of the time we say just because of improper burping you go, nothing will happen. Okay, so now we should have a clear-cut idea. If the vomiting is persisting for more than 12 hours in a neonate, so then it should be considered as a significant vomiting and we have to take the care. Okay, if it is present for more than 12 hours, then If it is present for more than 24 hours, frequently child is vomiting, and these particular vomiting episodes are not ending, it is continuing of 24 hours, whole day, in a 2-year-old child should be also considered as a significant. In a neonate means immediately after birth. So if the vomiting is not stopped even after 12 hours, it is significant. Because most of the time in the neonate, the vomiting may be because of consumption of the amniotic fluid, or sometimes the vomiting may be because of overfeeding, or sometimes vomiting may be also because of excessive handling. Okay, so many such maneuvers may lead to vomiting. So if that particular vomiting is continued even after 12 hours, then it should be considered as significant. Whereas in a 2-year-old child, suppose a child is 2-year-old child, and if the vomiting persisting for more than 24 hours, then it is quite significant and we have to immediately go for investigation. If it is persisting for more than 48 hours in any child of any age group after 2 years, of any child of any age group after 2 years, if it is persisting for more than 2 days, so then definitely it is not normal, not physiological, or not functional. Definitely there is some one or the other cause is there. So we need to investigate for that. And most of the time vomiting is self-limiting. So this is a known fact. Most of the time vomiting is self-limiting. If the vomiting is because of excess consumption of the milk, or if vomiting is because of some toxic substance which is present in the stomach, or if the vomiting is because of some other psychological disturbances, etc., overfeeding, etc., then usually it's quite obvious that it is self-limiting. Once the contents are emptified in the stomach, there should not be any vomiting. Okay, but even after the completion of emptification of the stomach also, still the child is having the vomiting sensation means, so this is something other than the routine things. So therefore we need to go for investigation. So this is the deadline, so where we have to take. In the neonates is just 12 hours, whereas in 2-year-old it is up to 24 hours. In 2 years it is up to 48 hours, or any child for more than in any child more than 48 hours, it is quite dangerous. Now we go to the next point, that is nature of the vomiting. Now if you look into the newborn or the infant, the most common cause of vomiting is aerophagia. Everybody knows. Okay, because of improper feeding techniques, or if the only nipple has been sucked by the child and the whole black areola has been not put inside the mouth, and there is that means the sealing is improper, then there is every chance of consumption of the air along with the sucking, and that air goes inside the stomach, and air being lighter than the milk, it gets collected in the upper part of the stomach, and it irritates the very immature cardiac sphincter, and sphincter suddenly opens, air comes out, and along with the air also the milk comes out. So this is called as aerophagia. Okay, this is called as aerophagia. So this is quite common, and whenever the mother comes with vomiting in the newborn period, this aerophagia has to be excluded, then only we have to proceed further. Okay, so now usually in case of aerophagia, what happens is although there is vomiting, there is the growth, that is weight gain, etc., will be normal. Okay, anyway, therefore we always advise for the burping. So burping helps to remove this air which is collected in the stomach, which may be accidentally consumed at the time of breastfeeding. By means of burping, it slowly helps to relieve the air from that particular area in the form of udgaras or eructations, and then the child is safe and there is no chance of vomiting because air has been gone out. Therefore we always suggest the burping. Burping should be done for 10 to 15 minutes preferably. Okay, this is one important cause and the commonest cause, and we need to assure the mother now. And also we have to correct the faulty feeding techniques. So mother may be feeding in the lying down position, or the mother is not ensuring the proper sealing, okay, or the position may be wrong, or again mother may be having some feeding problems like nipple problems, etc. So many causes are there. Now another important is we have to see whether the vomiting is bilious or non-bilious. Okay, if vomiting is bilious means the bile juice enter inside the intestine in the second part of the duodenum. Okay, so if omitus contains the bile substances, so that suggests that the origin of the omiting is from the intestine and it has been mixed with the bile juice. That means there is less chance of any congenital abnormalities related to the duodenum, like duodenal atresia. Okay, so if there's a bilious, it suggests the intestinal obstruction below the second part of the duodenum. Quite obvious, because the bile juice enters the intestine in the mid portion between in the second part of the duodenum. Okay, sphincter of Oddi and all those things. So now, so that means there is no obstruction till then. Okay, so obstruction, if at all it is there, it may be distal to this entry of bile duct. Okay, so that's one thing. Sometime omitting may be containing the blood. Of course, it is not mentioned here. Immediately after the birth, the mother may complain that my child is omitting the blood, or caretakers may complain child is omitting the blood. And usually the most common cause of blood omitting in the newborn child immediately after birth is the consumption of the maternal blood. Okay, usually during the time of the delivery, or some amount of the placental blood or some other blood may be consumed by the baby when it is traveling through the narrow vaginal tract. Okay, or if it is delayed delivery, the chance is more. So that blood may be entering into the stomach, and immediately after stomach you are removing it. It's okay. Suppose if something has been left as it is, the baby may omit the blood. Actually, it is called as, it is nothing. It is not the blood of the baby. It is the blood of the maternal blood. Some apt test is there to confirm whether it is a neonatal blood or a maternal blood. So that we'll see in some other classes. Okay. So this is another important cause of blood omitting in the children. Okay, consumption of the not in children, newborns, consumption of the maternal blood. Sometime omitting may be periodic. Sometime the omitting may be periodic. That means omitting is coming in every 15 days, once in every 15 days, once in every 1 month. So there will be omitting. Okay, such omitting is usually called as a cyclical omitting also. Okay, Ghati, Yantra, Grahani, like conditions are explained in Ayurveda, which can be correlated to some extent. Anyway, so these are nothing but metabolic causes. Because of some metabolic derangement which is happening, there will be collection of some of the abnormal toxic substances gradually. When it reaches a peak, then it will able to stimulate the omitting center and there will be omitting. Once the omitting is there, all the omitters has been emptified, again the toxic material gone, and again it takes some time to get collected again, and again there will have a episode of omitting after 10 days or 15 days or 1 month. Okay, this is so many metabolic causes may also lead to omitting. For example, omitting is quite common in diabetes mellitus, we know that, isn't it? So even in so many acidosis, alkalosis like condition, there may be omitting. Okay, ketoacidosis occurring in case of diabetes, so that may lead to omitting. The reason is again some of the metabolic causes, okay, leading to this acidosis and all. So that may also one of the cause of omitting. But in newborn, chance is less. But of course, the acidosis can occur in those babies with the birth asphyxia. Okay, so birth asphyxia, acidosis may occur. Therefore, previously we are giving sodium bicarbonate, okay, for the asphyxiated baby. So that is to prevent the chance of the acidosis like conditions. Okay, anyway, nowadays it is not practiced. Now some other causes which leads to omitting is cyclical omitting and even migraine in a quite older child. Migraine is also one of the most common cause of omitting. Anyway, so these are some of the important things that we have to understand regarding omitting. Now what we have to understand is whether the omitting is now whether it's a projectile or whether it's an early morning omitting, or sometimes it is also psychological. Now we have to understand these points. Omitting may be projectile. Projectile means it is coming very fastly and falling forward. Okay, it's very forceful expulsion which is falling forward and falling apart from the quite distance from the patients. Now usually congenital pyloric stenosis is one of the conditions where there will be projectile omitting. Okay, so in the newborn, as far as newborn and infants are concerned, always we have to remember this congenital pyloric stenosis. Of course, detail we will not see. This is one of the important causes. Another important cause is pancreatitis. Acute pancreatitis may also lead to projectile omitting. Acute pancreatitis is quite uncommon in the children, but the congenital pyloric stenosis is the most common condition in the children. Okay, So here there will be obstruction to the pyloric end, and whatever the food may be consumed, milk, etc., that will go on to stay there itself. And as a result, there is a distension of the stomach. When it reaches the peak, there is a stimulation, and all the things comes out. We will have a peristaltic, that means visible peristalsis there. Okay, then we will have a small swelling over the epigastric area. So these are some of the common findings we have. And omitus contains, characteristically, the food consumed in the morning will be omitted in the late evening or next day, because the food go on collecting there and it reaches the peak because of the mechanical distension, then the omitting starts. So this is one of the important clue for that. Then another chance of omitting is early morning omitting. So okay, early morning omitting is quite dangerous, not only in the newborn or what you say infants, but in quite older children also, for 3 years, 4 years, 5 years. Always early morning vomiting is quite dangerous, because early morning vomiting always suggests raised intracranial pressure. The cause may be anything. Cause may be hydrocephalus in children, cause may be some space occupying lesion, or cause may be some other infections, etc. Early morning vomiting, so that always suggests the cause of increased intracranial pressure, because of the in the night hours the patient goes to the horizontal position and collection and all those things. Anyway, if it is fluid pathology, then sometime vomiting is also psychological. Sometime vomiting is also psychological, and sometime vomiting may be there because of overfeeding, increased abdominal pressure, and sometimes even the bad smell may also lead to vomiting. These are some of the other causes of vomiting. If you go further now, just quickly look at the physiology of vomiting, because to understand vomiting in children, this is very important. Actually, vomiting will be taken place by two important centers in the brain. Importantly, two important centers are related to vomiting in the brain. One is a chemoreceptor triggered zone. Okay, chemoreceptor triggered zone. So there is a bilateral set of the neurons in the brainstem lying under the floor of the fourth ventricle. Chemoreceptor trigger zone is situated under the floor of the fourth ventricle. It is nothing but the bilateral set of the neurons which is situated in the brainstem, lying under the floor of the fourth ventricle. They function as chemoreceptors, sensing the chemical abnormalities or chemical changes in the blood. Any biochemical changes in the blood will be sensed. Any biochemical changes in the blood will be sensed by this chemoreceptor trigger zone, and as a result, vomiting center will be stimulated. This is one of the causes. This is how the metabolic waste will go into produce the vomiting in case of metabolic disorders. Okay, because of the metabolic waste, there are nothing but the chemicals, and these chemicals, when raised in the blood, it was sensed by the chemoreceptor trigger zone, and as a result, there is a vomiting. Another is central vomiting center. Central vomiting center. This is situated in the reticular formation of the medulla. In the medulla area itself, there is a reticular formation. We know that. Not reticular activating system, reticular formation is there in the medulla. So there actually central vomiting center is situated. They receive the signal from the visceral and as well as efferent nerves of the GIT. Any GIT dysfunctioning or GIT abnormalities, or any problem with the viscera, for example, a renal system disorders leads to vomiting, isn't it? Sometimes the hepatitis leads to vomiting. So this is the sensations carried from the visceras. Okay, so the visceral sensations and other GIT abnormalities disturbance, so that will be carried through the efferents to this particular central vomiting center situated in the reticular formation area of the medulla, and leads to vomiting. So like this, we have got two important chemoreceptor trigger zones and as well as central vomiting center. And we know that actually this particular vomiting center area which is present, it is not covered by the blood-brain barrier. Okay, that is one important thing. Therefore, whenever we consume some of the drugs like the NSAIDs or some aspirin, something, or any drugs, if you see the adverse effects of any of the contemporary drugs, pharmacological drugs, so vomiting and nausea, they are the most common adverse effects if you see, or side effects. Okay, the reason is actually whenever there is a drug metabolism takes place, there is production of some of the chemicals, and these chemicals pass through the blood and reaches a chemoreceptor trigger zone area which is not covered by the blood-brain barrier. Therefore, they pass us in and going to stimulate. Okay, so this is one of the cause. Whenever there is overdosing and all, so this may do happen. Now, if you see the physiology of the vomiting, actually the vomiting will going to take place in three important phases, because understanding these centers and phases, they are very important to understand the topic very well. Okay, that makes the concept very clear. So actually vomiting will take place in three phases. One is called as pre-ejection phase, another one is retching, and another one is ejection phase. So these are the three phases through which the vomiting takes place. Okay, so pre-ejection phase is characterized by the nausea and increased sympathetic and parasympathetic activity, like increased salivation, tachycardia, etc. Or sometimes there may be pallor, deep breathing with a gastric relaxation, sweating, and reverse peristalsis. If you look into the Vamana explanation given in Ayurveda, so you can compare this pre-ejection phase, retching, and ejection phase. Okay, so 3 or 5 are steps mentioned by Charaka. What happens? First there will be Swedagamana, then there will be upward movement of the Vega. So like this is explained. Anyway, then the second phase is retching, where the rhythmic contraction of the abdominal muscles will be there, respiratory and abdominal muscles. And third one is ejection phase, which is characterized by the intense contraction of the abdominal muscles and relaxation of the esophageal sphincter, leading to forceful vomiting. Now, normal physiology of the swallowing, if you look into normal physiology of the swallowing, which is related to this vomiting, is two sphincters are there. One is called as cardiac sphincter and another one is called as pyloric sphincter. Okay, now food is taken, whenever the food is taken, it comes into the stomach after churning, and then it goes through the pyloric sphincter, isn't it? So cardiac sphincter is the one which separates the esophagus from the stomach, we know that, and it is a physiological sphincter. Okay, so this is very important for the kids, because this is not much matured in the neonates and infants, and that leads to so many conditions, so many situations of regurgitation, which was confused by the mother as vomiting. So it's a physiological sphincter, not much specialized to prevent the backflow, especially in children. This is what I'm telling. This has to close completely, no doubt, but it is not so mature in children, so that it is not exactly in a position to prevent the backflow, especially in children. One thing. Second thing is, this is containing some of the smooth muscles, and it is supplied by the autonomic nerve systems, etc. Okay, that smooth muscle fibers around the sphincters. So they are very, very sensitive for stimulation. A small sensation is sufficient to stimulate it, because that's what happening with the aerophagia. Air coming and just touching or giving some stimulation to that smooth muscle, suddenly it gets opens. So they are more sensitive for any type of a stimulation. Okay, therefore this is an important cause for the gastroesophageal reflux disease. Another sphincter which is present is the pyloric sphincter. We know that pyloric sphincter will go into separate the duodenum from the stomach, but this is an anatomical sphincter. Okay, actually the cardiac sphincter is a physiological sphincter, but this is anatomical sphincter. So it is specialized to allow the content forward. So you can the contents cannot go randomly through the pyloric sphincter. Pyloric sphincter will have anatomical structures there completely. Such type of anatomical structures are absent in the cardiac sphincter. The muscles around the upper part of the stomach, and as well as muscles of the below portion of the esophagus, lower end of the esophagus, they themselves get modified into cardiac sphincter actually. Okay, but when you talk about pyloric sphincter, it's not like that. They contain separate muscles, smooth muscles, etc. Separate anatomical structure is there. So it is not so easy to pass through this pyloric sphincter. Okay, so it is a specialized, and it allows the content forward only when it is needed. So this stomach mucosa, this is well versed to manage the pH of 1 to 2, while the esophageal cells are not specialized to that. This is another important thing. The stomach mucosa in the lower part, that is in the pyloric part, so they are well versed to manage the pH changes. Okay, whereas in the upper part, cardiac sphincter, after the cardiac sphincter, that is in the proximal part, we have the esophageal muscles, isn't it? So these esophageal muscles are not much well versed for management of the pH changes. So when gastric juice comes there, it becomes an acidic pH, and there is no any system is there to neutralize it actually. So we will have esophagitis like condition, or sudden pain, choking, etc. will be there. Anyway, this is one of the important thing between these two sphincters. The pyloric sphincter is more matured and it's more safe, whereas cardiac sphincter is more physiological it is, and it is very sensitive, and it is not well versed in managing the pH changes. So when stomach contents when fall on the lower portion of the esophageal mucosa, it damages the mucosa of the esophagus. Okay, because they are not well versed to manage the pH, because acidic contents are coming, isn't it? When regurgitation is happening. So these esophageal cells are not well versed to manage that sudden change of the pH. So this is some of the basic concepts of vomiting before going to the detailed parts of the disease. And these are some of the important things that we have to know whenever we are talking about a newborn or infant with the